I just want to make a point that I hope the public gets. When people do model, they say, this is the lower level, this is the higher level, and what the press picks up is the higher level. And they'll say you could have as many as. Remember, the model during the Ebola outbreak said you could have as many as 1 million. Mm-hmm. We didn't have 1 million. Okay.
Oh, that's great. Okay, so I spoke to federally accredited clinics in my district, and one of the things that they are noticing is capacity.
Let me try something. Let me log on to YouTube, go to my channel. I want to see if what I wanted to show is what is showing. I'm trying to stream some media.
Help to communities like ours around the country is now being held up and politicized when this is really, there is no R or D next to this coronavirus. It needs to be able to move forward so we can get virus. But Mr. Kadlec, can you answer the question? Because this is exactly what I heard from the hospital, 2 of the hospitals, and 2 of my federally accredited.
Well, ma'am, two parts to deconstruct your question. One is about the question about whether or not border crossings would be inhibited, and I would have to refer to the Department of Homeland Security. But the other one, there are some work practices that have to be evaluated. There have been others who've questioned about whether or not the issues of furloughs are necessary for people who've been exposed or potentially at risk for coronavirus and how that works. I mean, in the state of Washington, for example, there are healthcare workers who are actually working, they're coronavirus positive but asymptomatic, and they're continuing to work on coronavirus patients so that they don't pose a hazard to someone who's not ill with coronavirus. So there are some issues that have to be sorted out there, but I will have to go back and for your question about the border control issue, I would have to make that reference to DHS.
Yeah, and I'll follow up as well. I mean, my last thing is, Dr. Redfield, you know, I think it's really important for this body, and I think both of my colleagues on both sides would want you to commit to providing the committee the current plan of how many tests that you can produce right now, what the plan is, whether they're expected to be ready, and how many people they will cover. And I don't know if you can do that and make sure you work with our chairwoman in getting that information to us by the end of this week.
I can tell you that we are trying to stand up a national reporting mechanism that's going to put not just the CDC test, not just the public health lab test, but the LabCorp test, the LabQuest test, and the individual hospital labs, so that we can have a single site where people can see how many tests have been done, how many tests are positive. And behind that, we're trying to look, at least in the public health system, or, you know, what is our current inventory in the public health system. And I can obviously relate that to my colleagues to see if there's a way for us to do that in the clinical system. But we will have a, we have it now, but it's incomplete because the states lag in their reporting because they're actually trying to do.
Yeah, I don't know if that's a yes or no, but get us the plan. That would be great. I think one of the things too is, you know, I caution us because we're also worried about the commercialized economy stopping, but we shouldn't be risking our lives for corporate greed. We should really be taking care of our families. We don't pass a supplemental that has been worked on hard from frontline people, various departments, of making sure we have, you know, people that have to not go to work. I mean, I'm telling you, one of my state agencies right now where you go get your IDs closed down because people didn't show up to work because they want to make sure they're getting protection, that they are being able to get access to testing and all those things. And I think it's really critically important that we understand that urgency because on the ground, offices are being closed, businesses are being closed right now, not just large events.
Okay, thank you. The gentle lady from California, Ms. Porter, is recognized for 5 minutes.
Dr. Kadlec, for some, that is $1,151. This all totals up to $1,331. That's assuming they aren't kept in isolation. Isolation can add up for one family already, $4,000. And fear of these costs are going to keep people from being tested, from getting the care they need, and from keeping their communities safe. We live in a world where 40% of Americans cannot even afford a $400 unexpected expense. We live in a world where 33% of Americans put off medical treatment last year. And we have a $1,331 expense, conservatively, just for testing for the coronavirus. Dr. Redfield, do you want to know who has the coronavirus and who doesn't?
Yes.
Not just rich people, but everybody who might have the virus?
All of America.
Dr. Redfield, are you familiar with 42 CFR 71.30, excuse me? 42 CFR 71.30. The Code of Federal Regulations that applies to the CDC. 42 CFR 71.30.
I think if you could frame what it talks about, that would help me. I don't relate.
Dr. Redfield, I'm pretty well known as a questioner on the Hill for not tipping my hand. I literally communicated to your office last night and received confirmation that I was to be asking you about 42 CFR 71.30. This provides the director may authorize payment for the care and treatment of individuals subject to medical exam, quarantine, isolation, and conditional release.
That I know about, and my office did tell me that. I just didn't know the numbers, ma'am. That's Congresswoman.
Great, so you're familiar. Dr. Redfield, will you commit to the CDC right now using that existing authority to pay for diagnostic testing free to every American regardless of insurance?
Well, I can say that we're going to do everything to make sure everybody can get the care they need.
Reclaiming my time. Dr. Redfield, you have the existing authority. Will you commit right now to using the authority that you have vested in you under law that provides in a public health emergency for testing, treatment, exam, isolation without cost, yes or no?
What I'm going to say is I'm going to review it in detail with
No,
CDC
I'm
and the department.
reclaiming my time. Dr. Redfield, respectfully, I wrote you this letter along with my colleagues, Rosa DeLaura and Lauren Underwood, Congressman Underwood and Congressman DeLaura. We wrote you this letter 1 week ago. We quoted that existing authority to you, and we laid out this problem. We asked a response yesterday. The deadline and the time for delay has passed. Will you commit to invoking your existing authority under 42 CFR 71.30 to provide for coronavirus testing for every American regardless of insurance coverage?
What I was trying to say is that CDC is working with HHS now to see how we operationalize that.
Dr. Redfield, I hope that that answer weighs heavily on you, because it is going to weigh very heavily on me and on every American family.
Our intent is to make sure every American gets the care and treatment they need at this time of this major epidemic, and I'm currently working with HHS to see how to best operationalize it.
Dr. Redfield, you don't need to do any work to operationalize. You need to make a commitment to the American people so they come in to get tested. You can operationalize the payment structure tomorrow.
I think you're an excellent questioner, so my answer is yes.
Excellent. Everybody in America hear that. You are eligible to go get tested for coronavirus and have that covered regardless of insurance. Please, if you believe you have the illness, follow precautions. Call first. Do everything the CDC and Dr. Fauci, God bless you, for guiding Americans in this time. But do not let a lack of insurance worsen this crisis.
And I would just like to echo what you said. It's a public health, a very important public health, that those individuals that are in the shadows can get the health care that they need during the time of us responding to this outbreak.
Well, thank you. And the gentle lady from New Mexico, Mrs. Holland, is recognized for 5 minutes.
Thank you, Madam Chair, and thank you, gentlemen, for being here today. We really appreciate you answering our questions. Dr. Redfield, I want to start with you first. The first 4 cases of coronavirus have been found in New Mexico, my state. We had a conference call with Governor Lujan Grisham yesterday, and she mentioned that 2 of the cases, it's a couple who lives in Socorro, New Mexico, a small town, 70,000 people perhaps, and they were on a cruise ship themselves. They came back to New Mexico. Nobody notified the state or the health department about them being on a cruise ship where coronavirus was found. So they were in New Mexico just doing their normal everyday life for 10 entire days before the governor or the state was alerted to have them tested, and it turned out they were positive. So I am, we're of course worried. In a small town like that, the virus could spread pretty rapidly. And so I want to, a lot of attention has been paid to testing. Will we have adequate testing? And I want, I'd like to know this adequate testing. I have to believe that it will reveal an exponential number of cases throughout the country, and what is the responsibility to just make sure that we are getting this information out to people. People on a cruise ship where coronavirus was known to be found shouldn't be walking around for 10 whole days before we're alerted to that fact.
Thank you very much, Congresswoman. Obviously, the complexity of tracking down people, whether it's ships or planes, is a complicated issue. First, you have to have accurate contact information. And I can tell you one of the things with the interim federal rule we recently did for airlines, in the past, maybe 20 to 30% of the information we would get would be actually actionable. I'm happy to say now we're probably over 90%. We're getting the manifest from cruise ships and working with local health departments to try to track down these individuals when we do have a confirmed case. And this is why Dr. Fauci and all of us have now really weighed heavily. This is not to be cruising. We really do realize that these are environments that can really amplify transmission.
Thank you. Thank you, Dr. Redfield. Thank you. I want to turn our attention, I think you've mentioned, all of you have mentioned several times today that big crowds need to be avoided. Is that correct? And I want, first of all, I want to just talk about our president for a moment. On March 8th, he tweeted that fake news media is doing everything possible to make us look bad. On February 28th, he called the coronavirus a Democratic hoax in front of a huge rally, which was on national TV. A Brazilian official who met with President Trump at Mar-a-Lago has just tested positive for the virus. And he has just boasted recently about his March 25th rally in Florida that it's sold out, and he has yet to cancel it. And this behavior, this is a behavior that our country has to contend with. He's our president. He is the leader of our country. You have been sitting here for hours and yesterday telling us that we need to avoid big crowds. And I'm going to tell you that I have Republicans in my district who I care deeply about. I don't want them getting infected. Every single one of us here have constituents all over our districts who we don't care who they support for president. We don't want them getting sick. And I applaud my governor, Michelle Lujan Grisham, who just canceled all mass gatherings in our state. And I almost feel like saying the president can do whatever he wants. He's an adult. He can be careless with his own health if he wants to. That's his choice. But the millions of Americans who would go to a rally because he has told them that it's a hoax, they don't know the truth, apparently. And it's up to all of us to make sure that they do know the truth. And and I understand the position you're in. If you can't tell the president to his face, stop all your rallies, cancel every single rally that you have planned because American lives are at stake, then I implore you to give that message to every governor of every state in this country. We have to stop this where it is, and I appreciate you you being here, and thank you, Madam Chair. I
The
yield.
member's time has expired. The gentleman from Maryland, Mr. Sarbanes, is recognized for 5 minutes.
Yeah, thank you, Mr. Chairman. Thanks to the panel. Dr. Fauci, I've been trying to sort of distill the testing issue against the backdrop of moving from containment to mitigation. And in my mind, and I'd like you to maybe just comment on it very briefly, our failure to get the testing done early, in effect, means we missed the containment window and now have to move rapidly to the mitigation stage of this thing. In other words, you've kind of been intimating, don't wait for the surveillance testing, don't wait for the person-to-person testing to make a judgment about what we have to do. We are past containment, well past it. There might have been a moment when we could have had an effective strategy around there if the testing had been deployed better. But we now got to go straight to mitigation in anticipation of the fact that whatever testing will now happen will show us that community spread has been happening for weeks and so forth. Is that a fair characterization?
With all due respect, sir, it's not totally fair. And let me very briefly try and integrate what you said, part of which was true, but part of which I think is maybe a little misleading. First of all, clearly, we've said publicly, we had a problem with the testing, and if we needed the kind of surveillance, we're not there yet. I don't think you could draw a direct line to that lack of having it in the beginning to the fact that we're now doing mitigation. Number two, you don't necessarily containment when you go to mitigation. You can do some containment at the same time you're doing mitigation. But I would emphasize, and I'm glad you're giving me the opportunity to state it yet again, because you could never state it too much, is that right now, all of us, regardless of what testing is going on, need to be doing the kind of distancing, avoiding crowds, teleworking where possible. I said it many times and I'll say it again. This is not business as usual. If you live in a state or a region where there are just a few or no cases, it doesn't matter. You really need to do the
Let me ask you, thank you, that's a very good clarification. Let me ask you a science question, just so I understand. If somebody got the virus 3-4 weeks ago, just thought they had the flu or a bad cold or something, recovered from it, they're now essentially immune from getting the virus again, is that correct?
We haven't formally proved it, but it is strongly likely that that's the case.
Okay.
Because if this acts like any other virus, once you recover, you won't get reinfected.
And if they then came down with another cold, not related coronavirus, thought maybe it was coronavirus, got tested, would that test show that they had gotten the coronavirus or not?
If you do an antibody test, if you wait weeks and months after you've recovered, the antibody test will tell you whether that person was formerly infected with coronavirus.
Okay. Following up on that, if somebody has the immunity and in that sense is not a carrier, they could still transmit, right, if they were in a space where they got the virus somehow on their skin or something else, so they could still put someone else at risk, even though in their mind they're thinking, I'm now immune and therefore I'm safe to move around, in a sense. Is that true? No.
Absolutely not. Thank you for asking the question. So let's say I get infected, and whether I get sick or not, I clear the infection from my body. I do 2 tests 24 hours apart, which is the standard to say I'm no longer infected. A month and a half from now, you do an antibody test, and that test is positive. I am not transmitting to anybody because my body has already cleared the virus. So even though my antibody test says you were infected a month or 2 ago, right now, if there's no virus in me, I am not going to be able to transmit it to anyone.
I'm asking a slightly different question. I'm going to run out of time, so I'll come down maybe, or I'll ask you offline so I understand that better. I did in the last 25 seconds here, though, just want to say that I'd like to follow up Dr. Kadlik, I believe, in terms of the the federal government's plans around telework, because obviously that's going to be critical in terms of continuity of operations. A lot of folks are already doing that on a discretionary basis, but I'm going to be interested in what the agency-wide response is there. I do have something I'd like to enter into the record, Madam Chair, which is testimony from AFGE, in part relating to the importance of telework and what they would like to see in that space, and I'd ask unanimous consent to submit that for the record. Thank you.
Thank you, Madam Chair. Thank you all for being here. Last night, President Trump announced that starting on Friday at midnight, he is suspending all travel from and to Europe to the United States for the next 30 days. Only the United Kingdom and appropriately screened Americans are exempted from this ban. The CDC previously recommended that all Americans avoid travel to China, Iran, South Korea, and Italy. It has recommended that older adults or those with chronic medical conditions postpone travel to Japan. Dr. Fauci, will a travel ban like this have significant impact on reducing the community spread of the coronavirus? That is, cases that are already in the United States.
Yes, that is the answer is a firm yes, and that was the reason, the rationale, the public health rationale, why that recommendation was made. Because if you look at the numbers, it's very clear that 70% of the new infections in the world are coming from that region, from Europe, seeding other countries. First thing. Second, of the 35 or more states that have infections, 30 of them now, or most recently, have gotten them from a travel-related case from that region. So it was pretty compelling that we needed to